So in this case, we have our normal labor, that is where the woman goes and push, boom, and then the baby comes out. And then welcome back to the channel. Thanks to all my subscribers for keeping subscribed to this channel. And if you're new here, I'm Miss International Midwife from Kolebu Teaching Hospital. I come with you to everything related to health, especially pregnancy, labor, women health, baby's health. That is my focus. Today on the channel, we are going to talk about labor related to medicine or labor related to pregnancy. So what is labor? We've heard about everyone saying, oh, the woman has gone into labor, she went to labor and she's back, congratulations. So what is labor? Labor is a series of continuous progressive contractions of the uterus, what you call the womb, where the baby lies, okay? And these contractions help the cervix, that is the opening of the womb, to dilate, that is open up gradually, and a phase, that is thinning up of the cervix. And this will open up completely and help for the passage of the fetus, what you call the baby, to come through the birth canal, that is the vagina, that we all know. And that is what we all call labor. There are different types of birth that a woman can go through. So the first and common one is normal birth, which is usually through the vagina. So we call it vaginal birth. And number two, also in the vaginal birth, we have something we call the assisted vaginal delivery, where the woman will go through a whole normal birth, but this time she has to be assisted. So it is called assisted vaginal delivery. This is usually done maybe with a vacuum or maybe some equipment that we call faucet. Yeah, it's a tool that will help us to deliver the baby. So that is assisted vaginal birth. So in this case, we have our normal labor, that is where the woman goes and push, boom, and then the baby comes out. And then assisted vaginal delivery, where the woman needs to be assisted to have the baby out of the birth canal. And then what we call shadow induction, where the onset of labor needs to be started medically or assistedly. There are many forms of it. So that is also there. And then the next one, that is the fourth one, is planned cesarean section. So in this case, due to one or two factors seen at antenatal, there is a plan or a scheduled cesarean section for the mother. And then the fifth one is unplanned cesarean section, which most of the times we call it emergency cesarean section. This could be due to a lot of factors like fetal distress, when the baby is in distress and cannot breathe, or when the placenta decides to separate before the baby comes out. So that is unplanned cesarean section. And then the last one is vaginal delivery after cesarean section. That is what we call the VBAC. So maybe someone had a cesarean section the first time, which mostly is an unplanned one or due to an emergency, which can be ruled out in the second pregnancy. So in that case, that client can have a vaginal birth after cesarean section, what we call the VBAC. Next is the stages of labor. In some contexts, they talk about 5 stages of labor, but I want us to stay to 4 stages of labor. So the first stage of labor can also be grouped into 3 parts: the latent phase, the active phase, and the transition phase. And then you have the second stage where the baby comes out, the third stage where the placenta, the uterus contracts, and all that. And then the fourth stage is about monitoring of the mother and the baby. So these are our 4 stages of labor. And then somebody will ask of the duration of labor. Some complain that I went into labor and they said I've prolonged or I'm delaying, so they decide to have a CS for me or to refer me. Yes, there is a duration for labor. Your labor shouldn't exceed 24 hours, especially if you have delivered before. So labor could be between 12 to 18 hours for your first time, and it should be shorter in your second and third pregnancy. But in all this, we monitor the progress of your labor, that is you, how your contractions are, and then the baby's health as well. If all these are fine, mostly when we monitor you, by 24 hours baby should come out and labor should end. But when we notice that you are exceeding, or either your health, your baby, or the uterus has any complication, baby must come out with immediate effect. So this is all I want to say about labor today. Stay tuned and wait for Mitsa on my next video diving into labor.